Welcome back to the deep dive. Today, we're going to try to,
Yeah.
we are going to dive into some medical coding training materials and
Yeah.
try to help everybody understand how this really important but kind of behind the scenes part of healthcare works.
Yeah, it's pretty amazing actually.
So we'll be looking at how these medical codes actually get used, what can happen if they're wrong, and we'll even try to solve some real life coding mysteries.
Oh, that sounds like fun.
Yeah.
Yeah, it really is a fascinating system. Think about it. Medical coding is like this secret language.
Yeah.
It takes these super complicated medical procedures and diagnoses,
Right.
turns them into data that like everyone in the healthcare system can understand.
Yeah, that's a great point. It's like a universal translator for healthcare. But where do these codes come from? Is there some giant code book hidden away somewhere?
Not quite a vault, but there is this super important book. It's called the ICD-10-CM,
Okay.
which stands for, get this, the International Classification of Diseases, 10th Revision, Clinical Modification.
Wow, that's a mouthful.
I know, right?
So this manual has, what, thousands of codes?
Thousands, yeah, for every imaginable diagnosis and procedure and even medical supply you can think of.
That's incredible. I bet there's a whole army of medical coders out there spending all day poring over this manual.
Yeah, you could say that. They work everywhere. Hospitals, clinics, insurance companies,
Wow.
even government agencies.
Mm.
They're the ones who take a patient's medical record.
Mm.
Doctor's notes, lab results, imaging reports, all that stuff,
Right.
and turn all that information into those standardized codes from the ICD-10-CM.
So they're like medical detectives, basically,
Yeah,
piecing together clues from the medical record to find the perfect code.
exactly.
But why is all this coding so important? Is it just for bureaucratic record keeping?
Oh, it's way more than that. Medical codes are like the foundation of how healthcare gets paid for.
Really?
Yeah, so when a doctor or a hospital submits a claim to an insurance company, those codes tell the story of what happened during a patient's visit. They're how you justify that the treatment was medically necessary, and they determine how much the provider gets reimbursed.
So if a coder makes a mistake or chooses the wrong code, that could really mess things up for the provider financially.
Oh, absolutely. Inaccurate coding can cause all sorts of problems.
Yeah.
Denied claims, delayed payments,
Oh, wow.
even financial penalties. It's serious business.
Huh.
That's why coders need to be super careful and follow all the guidelines really closely.
Yeah, I'm starting to see why this is a specialized field.
I feel like
It's a lot of responsibility. But how does a coder actually go about finding the right code? Do they just look up a diagnosis in the ICD-10-CM and pick the first one they see?
Well, no, it's a little more complicated than that. Remember, there are thousands of codes in that book.
Right.
So finding the right one is like a three-step process. First, you got to figure out what the main term is for the diagnosis or procedure or supply you're coding for.
Okay, so the essence of what you're trying to code.
Yeah, exactly.
What kind of things can be main terms?
It could be all sorts of things. Like you could have a specific diagnosis like chronic insomnia or a more general symptom like muscle spasms.
Gotcha.
You might even be coding for a specific medical device like, say, a continuous glucose monitor.
Wow, so every single thing in healthcare basically has its own unique code.
Pretty much.
That's incredible. So what happens after you've zeroed in on the main term? What then?
Well, that's when you go to the alphabetic index of the ICD-10-CM. It's basically like a big old alphabetical list of all the main terms with their codes.
Okay.
Kind of like looking up a word in a dictionary.
Right. Right. So if I was coding for muscle spasms, I'd go to the M section and look for muscle spasms.
Exactly. You'd find the main term, and right next to it, you'd see the code. Or sometimes it's a range of codes,
Uh-huh.
but that's not the end of it. You then have to go and verify that code in what's called the tabular list,
Okay.
which is a more detailed part of the ICD-10-CM.
So it's like a two-step verification process.
Right.
Why is that second step necessary?
Well, the tabular list gives you more information about the codes. It's organized into these categories and subcategories, and it also has all these really important guidelines and instructions.
So that's where the real details are hidden.
Yeah, kind of like the fine print of medical coding.
I bet that fine print can be pretty important for making sure you get the code right. What about those guidelines and instructions? What kind of things do they tell you?
All sorts of things. Like they might tell you when it's okay to code for a specific symptom along with a diagnosis, or they might explain how to code for a procedure that has multiple steps.
Okay.
It's all about making sure the coding is consistent and accurate.
Wow, this is getting pretty in-depth. It seems like there's so much knowledge and expertise that goes into being a medical coder.
Oh, yeah. and we've only just scratched the surface. But maybe we should take a look at some real-life cases to see how all these concepts work in practice.
Yeah, you mentioned some case studies earlier.
Right.
I'm definitely ready to see how these coding detectives crack the case.
All right, let's do it. All right, so case number 1. We've got Jane, a yoga instructor, coming in with a whole bunch of complaints.
Okay.
Hypertension, sinusitis, a detached retina, and arthritis.
Oh, wow, that's a lot. So where does a coder even start with a case like that?
Well, you got to really look at what the doctor wrote down. Remember, the first listed diagnosis, that's the key.
Right.
It's what the visit was mainly about, not always the most serious thing the patient has.
So, like, with Jane, it might not be the detached retina that's the priority, even though that sounds really bad.
Exactly. In this case, the doctor was focused on treating her sinusitis.
Okay.
So for coding purposes, that becomes the first listed diagnosis.
That makes sense. But what about all those other conditions? Do they just get ignored?
No, not at all.
Okay.
Even though sinusitis is the main focus this time, coders would still code for the hypertension, the detached retina, and the arthritis as like coexisting conditions.
Okay.
Those extra codes help build a more complete picture of Jane's health. They can be really important for keeping track of chronic conditions or even spotting potential complications.
So it's like building this detailed medical profile with each code.
Yeah, that's a good way to put it.
What if a doctor isn't really sure about a diagnosis, though? Like,
Yeah.
maybe they think a patient might have a heart condition, but they need to do more tests to know for sure.
Yeah, that's where things get a little tricky. The training materials really stress that you can't code for what you don't know for sure.
Okay.
So in that kind of situation, you wouldn't code for the heart condition yet.
Yeah.
Instead, you'd focus on the patient's symptoms, things like chest pain or shortness of breath, whatever they're experiencing right now.
So the codes always have to reflect what's actually known and documented.
Exactly. Got to keep it accurate.
Speaking of accuracy, the materials also mention something called excludes notes. What are those all about?
Oh yeah, excludes notes. Those are important. They're like little warnings in the ICD-10-CM. They tell you when you can't code certain conditions together. There are 2 main types.
Yeah.
Excludes 1 and excludes 2.
Okay.
An excludes 1 note means the conditions just don't go together, ever. It's really straightforward.
Like you can't be pregnant and not pregnant at the same time.
Haha, exactly.
yeah.
Excludes 2 notes. Those are a bit more nuanced. They mean you might be able to code the conditions together,
Okay.
but only if very specific circumstances are met. And those circumstances have to be clearly documented in the medical record.
So excludes notes are like little landmines coders have to watch out for.
Yeah, you could say that. If a coder misinterprets an excludes note, it can lead to all sorts of problems.
Like what?
Claims getting denied, audits, even legal issues. It can get pretty serious.
Wow, that's a lot of pressure. Coders really need to know those guidelines inside and out to avoid making mistakes.
Absolutely. And on top of that, they need to be fluent in medical terminology. All those long, complicated words can be intimidating.
Yeah, for sure. I remember struggling with medical terms back in biology class.
It is like learning a whole new language, but there's a logic to it. Once you understand the basics, the prefixes, suffixes, and root words.
Right.
And for coders, it's crucial because the words used in the medical record directly affect which codes they choose.
So it's not just about memorizing a bunch of codes. It's
Right.
about understanding the language behind them.
Exactly. It's
Yeah.
like being a translator, but you're translating medical jargon into data.
That's a really good analogy.
And speaking of data, there's a big question looming over the whole field of medical coding. What about technology?
Yeah.
With all the advancements in things like AI and machine learning, some folks are predicting that, human coders might become obsolete.
Right. It's kind of like, will robots be taking over the code books in the future? Or will humans always be needed? Yeah, it's a big question. It really makes you think. Like, AI is so fast and powerful,
Right.
but then you also need that human understanding of like medical language and context and all the little nuances.
It's a huge debate right now, in healthcare. And yeah, I do think that AI and machine learning, they could automate some of the coding work,
Right.
especially those tasks that are like really repetitive.
Right.
But I still think human coders are going to be super important.
So you see it as more of a partnership.
Yeah, definitely. Humans and machines working together, that's the future.
Okay.
Like imagine AI helping coders by spotting potential errors or suggesting codes.
Yeah, that makes
Or even doing some of that data entry stuff.
Right.
But then you've got the human coders who are really good at critical thinking,
Yeah.
They can look at a complex medical record and understand it. And they bring that ethical piece to the table, too, which is really important.
That's a good point. Like, remember those excludes notes we talked about?
Yeah.
I can see how AI could be really good at, like, flagging those. But it would take a human coder to really figure out if those notes apply in a specific case or not.
Exactly. And don't forget, healthcare is always changing. New
Right.
treatments, new technology, even new diseases popping up.
It's true.
So the coding system has to change too. New codes, new guidelines all the time. Human coders can adapt to that, but it'd be much harder for AI to keep up.
Yeah, that makes sense. So maybe the future of medical coding isn't about replacing humans with robots. It's more about, like, using technology to help humans do their jobs even better.
Totally agree. So what do you think? For someone who might be interested in a coding career, is it a good field to get into?
That's a good question. What do our training materials say?
Well, they say that the job market for medical coders is looking pretty strong, and it's supposed to grow even more in the next few years.
Really?
Yeah. And with all the electronic health records these days and this push for, like, value-based care, the role of the coder is just becoming more and more important.
So what kind of skills does someone need to be successful as a coder? It's more than just being good at following rules, right?
Oh, yeah, definitely. You have to be detail-oriented for sure, but you also need strong analytical skills.
Like a detective.
Uh-huh, yeah. Remember, you're piecing together those clues from the medical record to find the right codes.
Right.
And of course, you can't forget about that medical terminology. It might seem scary at first,
Yeah.
but once you learn the system, it's actually kind of cool.
Makes sense.
The training materials, they really emphasize that you got to be willing to put in the work,
Okay.
really dive deep into that world of medical language and coding guidelines. But if you enjoy solving puzzles and you're good with details and you're fascinated by healthcare in general, then medical coding could be a really awesome career.
Well, I think we've successfully cracked the code of medical coding today.
Haha, I think so too.
It's been a really fascinating deep dive, and it's amazing to see how much these professionals do to keep our healthcare system running smoothly.
It really is. And for anyone listening who wants to learn even more, I'd recommend checking out the resources mentioned in our source material. The APC and AHIMA websites, those are the two big medical coding organizations. They've got tons of information.
That's a great tip. And as always, knowledge is power, right? The more we understand about how healthcare works, the better we can advocate for our own health and well-being.
Couldn't agree more.
Thanks for joining us for this deep dive. We'll see you next time.